Coming up on Mountain News this morning, we have more details about a deal that is being called one of the largest emergency aid packages in U.S. history. And we talked with a Kentucky native currently living in New York, which is the current epicenter for the COVID-19 outbreak in the U.S. And we take a look at exactly how health officials at UK are performing and testing samples of suspected COVID-19.
Dedicated to Eastern and Southern Kentucky, this is WYMT Mountain News This Morning.
Good morning. The time is 6:01 on this Friday, March 27th. I'm Lacey Robertson. Thank you for joining us on Mountain News This Morning. It is Friday, which means you have made it through the week, whether you have gone to work or you've been at home with your children all week. You've made it, and it's time for the weekend. And let's bring in Brandon. For the weekend, we can also expect to kind of get outside as they continue to social distance, but I know we've got some maybe rain chances in the way.
Yeah, I don't think it's going to be too bad either day this weekend. Maybe Sunday morning could be a little bit on the rough side, but a lot of folks, of course, the church services, in-person services have been canceled, so you don't have to really go out as early on Sunday now. This morning, though, still dry. So we take a look at the satellite and radar loop for the last 6 hours. Now, we had some rain off to our north over into parts of Indiana and Ohio, back over into West Virginia, but nothing here in the mountains so far, and it shows because we are very mild this morning. 52 in Jonesville, 69 in Monticello. That's our range this morning. A lot of mid to upper 60s there across the region, and a lot of 60s in general. Very few 50s. There's 58 Middlesboro, 57 in Irvin, of course, there 52 there in Jonesville. These Ashland sensor out this morning there, but you see a lot of 60s and even 70 out toward Paducah this morning, 49 in the Tri-Cities. Your forecast for today, 79 is our forecast high. Again, ebb and flow with clouds today. We'll see more clouds at times than sun, see a little bit more sun this morning, and then we'll see, again, mainly just a stray shower north of the Howard Rogers Parkway Highway 80 corridor. We'll talk about the extended forecast here in just a little bit. Lacey?
Thank you, Brandon. The House is expected to follow the Senate in passing a $2 trillion stimulus package to address the coronavirus pandemic. The White House says President Trump is eager to sign the bill and quickly. Federal Reserve Chairman Jerome Powell says the economy may be well in recession already. And in relation to that stimulus package, we have received dozens of calls and messages from seniors who worry they won't get rescue checks. And we wanted to know too, so we reached out and talked to Senate Majority Leader Mitch McConnell directly. His office told us any U.S. resident with a Social Security number that is not claimed as a dependent is eligible. In a statement, they said this does apply to those who have no income, as well as those who receive income from non-taxable means tested benefits programs, such as Social Security. Now, the question still remains, though, of if they will receive the same amount as other U.S. citizens. Individuals who earn up to $75,000 will receive $1,200. Families will earn an additional $500 per child. And as the COVID-19 outbreak impacts many parts of the country, one of the hot spots for the virus is New York State, specifically the greater New York City area. WYMT's Madison Pergram talked to one Kentucky native who lives in New York City and works in the medical field.
It's an eerie scene. The streets of New York City are quiet and empty.
Everyone, I feel like, is communally worried about it, like out on the streets, in the parks. Obviously, the businesses and everything that's non-essential is closed.
As the city is what some could call the epicenter of the outbreak here in the U.S. Aniston Kane, a Kentucky native, is experiencing it firsthand.
Now that it's getting more serious, we're like getting more cases, like, you know, that are being tested positive. It's becoming like more anxiety inducing.
But as a patient care assistant at a hospital, she remains on the front line.
We're taking patients from all over now at this point because beds are just needed.
Experiencing the same struggles as many healthcare professionals around the world.
We're having to like really ration. You know, at this point, if you don't have a mask like that's soiled, if you don't have a mask that's ripped, if it can be used, we're trying to use it as much as possible.
Keeping focus on the task at hand day by day. Showing how we were all in this together, fellow Kentuckians continue to check in on her, reminding her of that old Kentucky home.
People start reaching out to me and are, you know, asking me, am I worried? Am I doing okay? Am I healthy? Am I safe? Yes, as far as I'm concerned, I'm not presenting symptoms. I'm trying to remain as safe as possible.
while she continues to do what she says she signed up for.
I love what I do. I kind of like, feeling like I can help people. I mean, that's why I chose the field that I'm in.
Part of a field that is battling the pandemic head on. Madison Pergram, WYMT Mountain News.
Kane does say that she encourages everyone to continue washing your hands, practice social distancing, and to protect the most vulnerable during this time. And back here in Kentucky, Governor Beshear is urging everyone to stay healthy at home as we try to stop the spread of coronavirus. There are now at least 248 cases of COVID-19 in Kentucky. The governor also announced 50 new cases last night. It's the highest one-day total of new cases. The governor says Kentucky still has not seen the peak of the virus yet, and he says it's critical everyone do their part to social distance and protect Kentuckians. He also urged county judge executives and mayors to make sure large groups are not gathering at parks. The Lexington Herald Leader reports a McCreary County woman who tested positive for the virus had to be ordered by a judge to stay home. This after health officials said that she refused to quarantine herself. They received complaints to their hotline about the woman from people who saw her out in public. Violating that order could lead to criminal charges. And in last night's news conference, Governor Andy Beshear said a 90-year-old man who was at a nursing home in Perry County had a confirmed case of COVID-19. But a short time later, it was announced that the result was actually negative. Now, yesterday we talked with Public Health Director Scott Lockard, who said typically once a COVID-19 test is processed at the state lab, the local public health directors are notified before Governor Beshear gives his daily news conference. Lockard says while the state was processing more tests yesterday, a mistake was made.
What happened today in this process is we had not received any notification until the governor had already went on air, and then right as he was going on air, I received notification that this was pending, and so evidently the governor was provided some misinformation that this test was positive when in fact it was still pending.
Lockard says if there is a positive case in Perry County, he will be notified and will work with local officials to make sure everyone is informed. But again, as of this morning, there are no confirmed cases of COVID-19 in Perry County. And as more testing becomes available in the Commonwealth, health experts say that we are likely to see a rise in coronavirus cases. But more testing also means the labs are working around the clock to turn around results. Shelby Lofton shows us the behind-the-scenes work of testing at UK's lab in Lexington.
Coronavirus tests at UK went live last Friday. It begins with a swab.
We push it up as far as we can go, up into the nose. We're trying to get way back in there to a place called the nasopharynx. And so if it hurts a little bit, or if it's discomfort, if it's not very comfortable, that means that we've done a good job at getting that collection.
It's sealed and taken to the lab.
We're going to take an aliquot from that liquid, and we're going to place that into another tube, and we're going to put that on a rack with a lot of other tubes.
94 at one time, to be exact.
We're going to put that into an instrument that's going to end up performing an extraction process to where we can isolate out any genetic material.
But it doesn't end there. A second piece of equipment runs the test that detects whether or not the virus is present. All of this takes place in a rather tight space.
We do our best to social distance within the laboratory, but we certainly are constrained with the space that we have.
And with limited supplies.
We actually have daily huddles and discussions about how many tests do we have available and what is our collection availability.
Gerwitz says they're adding more hands to the testing process. She says she's inspired by her colleagues' Team Kentucky attitude.
Volunteering to even work extra shifts when needed, having different staff in other areas of the laboratory offer up their skills to help us in this process. It's really been very inspirational to see everybody come together.
In Lexington, Shelby Lofton.
Now, doctors at UK say they have a good supply of tests and personal protective equipment for themselves right now. And they say it's important to recognize the negative test results, too, because those have a huge impact on preserving resources. Hazard Community and Technical College is also joining the efforts to help others during this outbreak. HCTC is donating what supplies they have from their allied healthcare programs and science labs to local clinics, hospitals, veteran centers, and nursing homes. President Dr. Jennifer Linden says they hope that they can get these items to those who need it most.
We're donating items like gloves, gowns, masks, anything that can be used for personal protective equipment.
Dr. Linden says the facilities have responded with excitement about receiving those supplies. And even healthcare workers are not immune in this economy. St. Clair Healthcare in Moorhead announced it's furloughing 300 people. That's about 25% of the hospital's workforce. St. Clair says the workers will not lose their health care. The impacted staff are not directly involved in the hospital's COVID-19 operations. St. Clair also says it's seen a significant decrease in patient visits within the last couple of weeks.
The weather this morning can be summed up in 2 words: mild temperatures. Let's take a look at that map this morning. You'll see 50s, 60s, and close to 70 in some spots this morning. We had Williamsburg was at 72 when we started the newscast at 5, but again, dropped just a little bit there. Iced coffee type of day across the region. You don't need any hot coffee unless you just like hot coffee, and then that's fine. We're looking at the emoji cast today. Scattered rain chances. I would even call them stray as we go deeper into the afternoon north of the Howard Rogers Parkway Highway 80 corridor. Tomorrow, chances late. Could see some stronger showers and storms in the overnight hours, and after that rain wraps up early Sunday, back to some sunshine. Lacey?
Thank you, Brandon. And thank you for joining us on Mountain News this morning. We have more news on the way. Coming up, we'll show you how Kentucky's Attorney General is cracking down on price gouging here in the Commonwealth.